Hello, good afternoon everybody. I hope you all can hear us. My name is Eva Vat. I'm the Training and Capacity Lead for Annual Support. And today we will talk about annual support and our funding opportunities. The guest speaker of today is Catherine Street, and she is the Director of Annual Support. We are very pleased that so many people joined us today. We have people from all across the province. And we have a mixed group, so we have professionals joining us, researchers, patients, students, decision makers. So we are very, very happy with that. Since this is our first session, we might run into some technical problems. So I just want to show you how this webinar session looks like and how you can participate. On the screen you see what you will see on your screen as well, and the most important feature is the chat box. You probably see this in the left side below at your screen. We are not using any webcam or speaker, so we're not able to hear you or see you, but you can talk with us using the chat box. So can you all hear me? Please just leave a chat or just vote. Oh, I see people voting, that's great. So it seems to work. If you cannot hear me or is any technical issue, please contact our technical support number, which you can see on the slide. I will now introduce you to Catherine Street. At the end of the presentation, we will have time for questions, so please save your questions and add them to the chat box when the time is ready. And at the end of the presentation, I will also come back to you and explain to you a little bit more about our training program. So let's start.
Hi everybody, and thank you Eva for that introduction. As Eva said, this is our first webinar, so we may have some technical issues, and it's also the first webinar I've ever done. So if I'm talking too fast, if you can't understand my accent, anything like that, please just drop a note in the chat box so Eva is aware and she can give me a little nudge to slow down. Okay, so what are the learning objectives of this, our first webinar? We're going to talk to you about the background to and purpose of Newfoundland support, tell you about some of the opportunities available through Newfoundland support, talk to you about the funding we have available to researchers and graduate students, and also talk to you about the resources we have online to assist you with taking forward patient-oriented research. So I'm going to start with some of the background to the strategy for patient-oriented research, which from now on I'm going to refer to as SPOR, because it's much quicker and easier to say. SPOR is a nationwide initiative which is being developed by the Canadian Institute for Health Research. I'm sure that many of you are aware that there's been a tremendous amount of research done across the whole country funded by the Canadian Institute for Health Research, and most of that research is at the highest standard possible. However, what was identified by CIHR is that much of that research was not having a direct and immediate impact on healthcare and health delivery for the patients of our country. So the Strategy for Patient-Oriented Research, SPOR, is focused on improving outcomes for Canada's healthcare system, for the users of Canada's healthcare system, so our patients and their families. And it aims to create a culture around achieving real-world change, so that's real-world change at the bedside, in the family practice office, for patients and their families. So when they set up SPOR, I think somebody thought we're going to try and confuse as we set this program up, because SPOR covers two initiatives: support units, which are local research support infrastructures which facilitate patient-oriented research by providing people, equipment, services and resources to support patient-oriented research. It also covers the national SPOR networks. Now these networks have both a national, as is given away by the name, and provincial focus. Now they say they're disease focused, but the first one that was developed is actually a primary healthcare network. The local primary healthcare network, which does work within Newfoundland and Labrador, but reaches out to other provinces and jurisdictions across the country, is run by Dr. Chris Aubrey-Basler and is referred to as the Prime Network. So if anyone has any questions regarding that, please drop either an email and we will contact Chris and the Prime coordinator with those questions. There is also a mental health network, which again has a national and local focus. The mental health network focuses on child and young adolescent mental health disorders, and the local lead for that here in Newfoundland and Labrador is Kathy Payton. The name of that program is Access MH. So in addition to those two networks, CIHR recently announced funding for 5 chronic disease networks. And I'm afraid I do have to refer to my notes for the names of these because I just cannot get them in my head. But the 5 networks are the Chronic Pain Network, which runs out of McMaster University, CANSOL CKD, which is Listening, Learning, Leading, Canadians Seeking Solutions and Innovations to Overcome Chronic Kidney Disease. That is run out of the University of British Columbia, but has what I'd refer to as a spoke from a hub and spoke model here within Newfoundland and Labrador, and Dr. Brandon Barrett is the local link to the CANSOL CKD network. There is also a network in diabetes and its related complications, which runs out of the University of Toronto. There's a Child Bright, Child Health Initiative Limiting Disabilities, Brain Research Improving Growth and Health Trajectories, which runs out of McGill University. And the final one is Inflammation, Microbiome, and Alimentation, Gastrointestinal and Neuropsychiatric Effects, or the short name for that is the Imagine SPOR Chronic Disease Network, and that runs out of McMaster University. Again, if anyone has any interest in those specific areas, please contact us. Oh, I just noticed, Eva, we're having a question, is anyone having a hard time hearing? I'm going to let Eva deal with that. But going back to the presentation, if anyone is interested in getting involved in any of those 4 networks, please let us know and we will link you in to the correct people. So now back to actually support units and the Newfoundland support units. Support stands for Support for People and Patient-Oriented Research and Trials. And as you can see from the map on the right, the support units have provincial boundaries. They work on what's referred to as a jurisdictional basis. And they all have provincial or territorial boundaries apart from the Maritimes. It was decided in the Maritimes that the 3 Maritimes provinces would come together to form a Maritime Support Unit. These units are responsible for creating the connection to teleconference has failed. You've cancelled the call, Eva. Yeah. Can I just check? Can anyone hear me still? Okay, I'm going to carry on. Okay, I had a strange message come up saying that the call had been cancelled. That's a relief that it hasn't. So as I was saying, the Maritime Support Unit, the 3 provinces came together to develop the Maritime Support Unit. The territories have developed support units, but they tend to be on a smaller basis. And each of these units is responsible for creating the resources to support and grow patient-oriented research within each province. And the areas of research that people are focusing on within the support unit are based on priorities decided through consulting with our patients and partners within the jurisdiction. And I'll talk more about how we've done that locally. So Newfoundland Support specifically. Our funding started in February 2014, with us officially going live in November 2014 when we moved into the beautiful new Craig L. Dobbin Genetic Research Centre, a picture of which is on your screen. I think that was the architect's original plans. Now, to add another layer of slight confusion for you, the Newfoundland Support Unit comes under the Translational and Personalised Medicine Initiative here at Memorial University, which is a collaboration between IBM, Memorial University, the provincial government, including Department of Health and Community Services, Business, Tourism, Culture and Rural Development, and the Research and Development Corporation. The Newfoundland and Labrador Centre for Health Information, the federal government through our funding agencies of CIHR and the Atlantic Canada Opportunities Agency, and other jurisdictional agencies with a stake in patient-oriented research. We really should change that sign, that line not to say agencies, but others, but just others with a stake in patient-oriented research, because that includes regional health authorities, the Centre for Applied Health Research, and most importantly, our patients. So the Newfoundland Support Unit has a funding envelope of approximately 20 million, 9.8 million from CIHR, 7.2 million from the Department of Health and Community Services, and you may be surprised to know we also have funding from IBM to a level of 2.8 million. And I'll explain further in the presentation what IBM's role in this work is. So how can you access support from Newfoundland Support? Well, we exist to assist research that is patient-oriented and focused on Newfoundland and Labrador. And if you just need one-off advice or a small amount of support from us, that is all your research needs to meet. That's the only criteria, that it's patient-oriented and focused on Newfoundland and Labrador. It may have a national remit, but as long as it's got some involvement of our local population, then we can help you. However, if you're looking for more research, for more support than that, such as funding from us or staff time, significant staff time, then your research must also focus on the priority areas decided between Newfoundland Support and the local community, including our patients. So I've talked a lot about patient-oriented research, or at least used the phrase, but what is it? It is any research which engages patients as partners. I'm not saying research that has patients as participants or subjects, but patients as equal partners on the research team. It must focus on patient-identified priorities, and it must improve patient outcomes. It must have a direct and immediate impact on patient outcomes, patient care, service delivery. So who are patients? Well, I actually think, using the CIHR definition of patients being inpatients, outpatients, carers, families, and any member of the public with a stake in improved outcomes, that really means anybody. It means our public, our citizens. Because if we think about that last bullet point, unfortunately, every single one of us, I think, will at some point have to interact with the healthcare service as a patient. And therefore, we all are members of the public with a stake in improving outcomes. So what is patient engagement in research? This just gives you two definitions, one from the CIHR and one from Involve, which is the National Health Service organisation within the UK responsible for involving patients in research. So the CIHR say it's meaningful and active collaboration in all stages of research. And Involve says it's research carried out with or by and not to, about or for. So very different from just being a subject or a participant. So locally here at Newfoundland Support, how do we engage patients? Just going to give you a chance to quickly read through those bullet points there, and I'm going to go into each of them in a little bit of detail. So the first one, consultation on research priorities. This is a lovely picture of Eva and I on a beautiful spring day in Grand Falls, Windsor. As you can see, it was absolutely freezing cold. However, May in Newfoundland, what do you expect? We've done a number of town halls. We've done some here on the Avalon, based in St John's, either general invitation or targeted. We actually had a most enjoyable experience meeting with the Seniors Resource Centre mall walkers in Fog City early one morning, where we were able to talk to the elderly regarding their priorities for health research. We also did a trip out to Fairyland. But we're very aware that we needed to go wider than the Avalon. So we travelled across the province on what we affectionately refer to as our Go West tour, where we visited Corner Brook, Deer Lake, Portobasque and Grand Falls, Windsor. Now we did find that when we asked people about talking about their priorities for health research, they really weren't that engaged. However, when we talked to them about what they want to see changed in health service delivery, they were more than happy to talk to us. And we actually did more than just organise town halls. We went out and found people in locations where people congregate. Town halls, and I believe this one, we're in the park in Grand Falls, Windsor. So we listened to what their priorities were, and we heard what they had to say to us. So, patient priorities. You'll not be surprised by a single one of these, and these came up across the whole area that we consulted. Firstly, healthy living. People told us that we need to teach children to cook. They need to know what healthy eating is. We need to bring physical education back into the education system. Patient-focused care. One lady recounted a story of how she had asked to join the case conference, the ward round, to discuss her elderly relatives' care. She was told that, we're sorry, but patients and their families don't join case conferences here. She felt very much that if they were to improve the care of the patient, both in hospital and when they're discharged, that involving the patient's family in the discussions would be of assistance. Wait times and accessibility to services. One of the gentlemen we met in the park told us that it's quicker to drive his daughter to Gander to meet with a paediatrician than to wait in Grand Falls, Windsor. Cancer and hereditary diseases. We heard from a number of people that they'd like to know more about the signs and symptoms of the diseases that are prevalent within their communities and what preventative steps they should take to try and reduce the likelihood of that disease for them and their family. Community-based care. A lot of people spoke to us about how difficult it is when their elderly relative is first discharged from hospital and how they'd like more community services to prevent the patient from being readmitted. This was echoed for people with younger physical disabled individuals within their family. They felt that the burden of care fell to them and that there should be more research into the needs of these patients. Recruitment and retention and access to physicians. Patients told us, again in rural communities, they'd like to see the same physician more than once. The turnover of physicians they felt was too great. And also in terms of access to their physicians, they'd like to be able to talk about more than one issue at a time. We had one gentleman who told us that in the morning he talked about the problem in his right knee, in the afternoon he talked about the problem with the same doctor in his left knee. Mental health. We had a physician attend one of our sessions who told us that she could run her whole practice on young adult mental health issues. And finally, the other issue that came up was interdisciplinary teams of healthcare professionals. If we haven't got enough physicians or we can't access the physicians, what about the pharmacist, the nurse, and the role of nurse practitioners? So as I said, I'm sure none of those are a great surprise to you, but they're all areas that the community are telling us we need to look at. So we engage patients by going out to talk to them, but that wasn't a constant group of people. We've done a number of other things to allow us to talk to the same patients about what they believe we should be doing and their engagement within our governance systems. We have a very active and effective patient advisory council with 20+ members. I noticed that a number of them are actually on this call, so I'm going to say thank you to those members now, but also to say we're looking for more members for our patient advisory council and network, because the majority of our patient advisory council are those people who may have a little bit more time to volunteer, so they tend to be middle to older age. They also tend to be, from what we understand, more highly educated, and also we believe of a higher social economic class. We have nobody from disaffected youth. We have nobody from hard to reach groups. We have, as far as I'm aware, no young new mothers. So we need to look at how we can extend the group of patient advisory council and network members. But our group we have at the moment, as I say, are fantastic. They have assisted us with lay summaries. So a number of granting agencies now ask for a lay summary to be written when you submit your grant application. We have 20+ people more than happy to assist and comment on any of those that you may need to write. They've met with a number of researchers and advised on priorities and the focus and writing of grant applications. And they've also been actively involved in reviewing funding applications for Newfoundland support funding, both for educational funding and for our annual funding call. We have a steering committee, scientific advisory committees, and project group, all of which have patient advisory members. For example, our steering committee now has 3 members with equal voting rights to everybody else on that committee. And due to the hard work and diligence of Eva, each of our research teams now also has patients engaged. So patients there are able to advise on implementation research, on information that's being sent out to patients, and also the structure of the research. So as you can see, there's a lot of opportunities for engagement, and we're continually trying to extend that. So why patient-oriented research? This is a slide that demonstrates why people believe patient engagement in research is worthwhile and valuable. There has been some evaluation done of this, and we are working with the Canadian Institute of Health Research to try and develop new ways of evaluating the impact of patient-oriented research here in Newfoundland and Labrador. I have to say I was talking to a colleague yesterday who wasn't talking about patient-oriented research, but she was talking about her child who has a disability and how when she met with professionals, she felt like screaming at them, "You don't understand unless you live with it every day." And that is why patient engagement in research is so important. We think we understand, we think we can emphasize, but we don't live with a disease or a condition every single day. So, what can Newfoundland Support offer you? That was a lot of background. What are we actually there for you? This slide shows the core services that each support unit is required to offer. And I'll talk about each of those in a little more detail in a moment. But again, you'll notice that patient engagement is at the center of all of our cores. So data platforms and services. I mentioned earlier that IBM have invested a significant amount of money in the work of Newfoundland Support, and that was in developing the Centre for Health Information and Analytics, which is our data platforms and services core. We have upstairs on the 4th floor here in the Craig L. Dobbin Genetic Research Centre $10 million worth of IBM equipment. We actually have the fastest and most powerful computer in Eastern Canada. I might actually have to say the Atlantic region. I may have exaggerated a bit there. So in the Atlantic region. Now the reason IBM have invested so much money, which includes they put $5 million worth of equipment in, we matched it with another 5. They've made available $5 million worth of staff time, and we have available to us up to $20 million worth of software and programs through the academic initiative. The reason they have invested that money in us is because we need to do data analysis and data management. And they are hoping that some of the tools that we develop here in Newfoundland, they may be able to then share across the wider country and into North America. So they see us as a little incubator for them. So the Centre for Health Information, which anyone who accesses support through Newfoundland Support can use the resources of, can assist you with analysis and data management. And they can also assist you with expediting access to data for our partnerships with the Centre for Health Information and through regional health authorities. Next core is method support and development. We're very lucky to have as our clinical director, Dr. Brendan Barrett, who has significant experience in developing study design and undertaking research. He is there for you as a sounding board for advice on study design. We also have a biostatistician who is available to assist with data analysis and biostatistics. Health services research, knowledge translation and implementation research. We recently appointed Dr. Amanda Hall as a postdoctoral fellow to work with projects within Newfoundland Support, assisting them with project design and ways to disseminate information. We're also just starting a brand new initiative referred to as Choosing Wisely Newfoundland, which links to the Choosing Wisely Canada initiative, which is all about implementation of research findings. So we're also developing a great deal of skill within implementation research. So as well as Amanda Hall for that, we also have Dr. Holly Etchbury to assist with implementation research. Real-world clinical trials, we're here to assist with design and resources for real-world clinical trials. And consultation and research services. We are more than happy to help you with writing your grant application, sorting out how to do your budget. Just basic things where you may just need a little bit of assistance in writing your grant application. We are here with for that. And our link for that at the moment is Dale Humphreys, our research officer. Career development and methods in health services research. The whole point about the support units is to become sustainable, to develop staff, to ensure that we have a culture change in terms of patient-oriented research becoming at the forefront of people's thinking. So to do that, we're doing the webinar series, this of course being the first one, and Eva is organising a number of workshops regarding patient engagement and patient-oriented research. There'll be more information about that, or the link for that to follow. We are also in the process of actually developing a diploma in patient-oriented research. And we have set up a training fund. We all know how difficult it is when everyone's on limited funding to find the funding and resources needed to go and present your work at conferences, to find a way to disseminate your information to wider groups. we have available for anybody who's involved in patient-oriented research what we refer to as a training fund. So if you have an idea about how you want to present your research, come to us, we may be able to assist you with the funding. I have to emphasize though, that is only for patient-oriented research. Patient engagement. We're there to assist you in finding patients as your partners. Eva will assist you with that. And when you've found your patients, we're there to assist the patients in ensuring that they are involved effectively, that they don't feel that they're tokenistic and they're just there to tick the box. And of course, we can also encourage you to access our patient advisory counselling network. We meet formally 4 times a year, but we are also able to communicate with them and take their advice via the internet, email, telephone, etc. So that's what we can offer you in terms of our course, but we also have funding available. We have 3 funding pots. I'll give you a little bit more detail on those now. So the first one, our educational student funding, which I believe is entering its 4th call. We do a twice-yearly call for students who are undertaking patient-oriented research in master's or PhD programs. We are able to top up student funding for masters for up to $14,000 for a period of up to 2 years. And for PhD students, we are able to top them up to $18,000 for a period of up to 3 years. The call for the educational student funding is currently out. The closing date is the 14th of October, and the link on the screen takes you straight to the page which has all the applications and information regarding the call. Patient-oriented research grants. We've just announced, it's up on all the screens around the university now, our 2nd call for patient-oriented research grants. I'm going to refer to my notes here. So these grants are there to support patient-oriented research, which has the potential to improve health of individuals, families and communities, support new research which addresses the healthcare priorities of the people of Newfoundland and Labrador, as identified by the people of Newfoundland and Labrador, to enhance the role of patients and citizens at all levels of the research process, from the start of the research, the planning of the program, to the implementation of the findings, and to build and sustain a full range of applied health research, including development and utilization of evidence-based decision-making, health education, and health policy and administration in Newfoundland and Labrador. For this year, as with last year, we have $300,000 available for up to 4 grants of $75,000. If the grants come in at less than $75,000, we could fund 6 at $50,000. It doesn't have to be a $75,000 grant. The expression of interest is closing on the 31st of October, and the application closing date is the 31st of March. I must emphasize that we will only accept applications where we have received an expression of interest. The reason there is such a long time between the closing of the expression of interest and the closing of the application is that when we get the expressions of interest, we're not planning on ruling anybody out. What we're looking at is finding which ones are maybe struggling with patient engagement, and we will be able to support them in ensuring that they have patient engagement. And also, a number of the people submitting these applications will not be your senior researchers, but will be new researchers. So we also want to be there to assist them in writing the grant application. So we want to ensure that we get the highest quality grants in March 2017 that will be reviewed by a peer review panel and our Patient Advisory Council. Again, the link is on the screen. So what are the priority areas for the patient-oriented research grants? These were the priority areas identified in our town halls. You'll notice that not all the priority areas are there, but these are the ones that came up most often. So we're looking at the area of access to services, primary care, physician retention, continuity, alternatives to accessing your doctor. We're looking at support services for mental health and paramedical support. And we're looking at improving access to services by reducing wait times. So the applications we receive will be assessed on the following criteria: their relevance to the proposed research and priority research themes, the incorporation of patients and partners. I cannot emphasize how much we will emphasize the incorporation of patients. Expertise and research experience. As I say, you don't have to be an extremely experienced researcher. We will be looking at also funding newer researchers. The merit of the proposal, the presentation and appropriateness of the research plan, the feasibility of the work, and my favourite bit, the appropriateness and justification of the budget. Now, we are encouraging partnerships. We're looking for researchers to work in partnerships with patients, community and patient organisations. So although a patient or community organisation cannot be the principal investigator, we would be very happy for them to be the co-applicant. So please try and think a little bit out of the box if you're submitting applications to this. If you've got any questions, come to us. And as I say, we're not ruling anyone out. It's expression of interest, and we will be helping and guiding people on how to write the best application they can. Just to give you a quick overview of the grants we funded this year, we actually managed to fund 5 because 2 came in at under 75. So we have Dr. Chris Aubrey-Basler, who is looking at diagnostic imaging utilization in the emergency room. We have Dr. Deborah Kelly from pharmacy, who will be looking at those patients discharged from hospital on more than 5 medications. We know that those patients who go out with more than 5 medications with a chronic condition tend to actually come back in because they're not sure what they're supposed to be taking. There's still stuff in the bathroom cabinet that they didn't realise they should have stopped or they should be taking. So the pharmacist will be meeting with these patients and making sure they understand what they should be taking. Kathleen Sitter from Social Services will be working with survivors of breast cancer to develop digital stories to explore their experiences, to try and help new patients make those decisions about surgical treatment. And the last 2 I'll tell you a little bit more about in a short while. The third source of funding that we have available, which we're still in the process of working up the detail of, because we want to work that detail up with our Aboriginal communities, is funding for Aboriginal communities that will be targeted to meet their needs. We're just at very much first ideas. We have $75,000 available this year, as I said, targeted to meet the needs. But we're not going to tell people what their needs are. We're going to work with the communities to develop the eligibility, to develop the priorities, most importantly to develop the review process, and also to confirm the timelines. And that funding call will be launched in 2016-17. And again, in fall 2016, winter 2017. And again, we will be encouraging the researchers and the communities to work together. And for this call, we are expecting that the communities will take a lot of the lead in the work. So right, that's all the background. What research are we actually doing? What have we been doing with ourselves for the last year and a half? So this is a list of the current projects. I'm not going to go through them in detail, but you can see it's wide-ranging, both hospital and community-based. If anyone has any questions on these further on, we can address those. Just going to give you an example from 3 of the projects. The first one is drug utilization. Do we give the right drugs to the right people at the right time? I'm sure most of you have heard the press around the use of antipsychotics. It is believed, and in fact the evidence indicates, I should say, that antipsychotics are being overprescribed. And specifically, they're being overprescribed for elderly patients in long-term care homes. And unfortunately, some of this prescribing is a way of managing some of the more disruptive, wandering behaviours of patients in long-term care. They do, of course, have significant side effects, and 2 of those being confusion and dizziness, both of which can lead to a reduced quality of life for the patient and also a risk of falls. The risk of falls in a nursing home can be very debilitating to the patient, and if you look at the whole healthcare system as a whole, costs significant amounts of money. So the research team is working with the long-term care homes and our partners in the regional health authorities to design interventions to make sure that only those patients who need antipsychotics are actually receiving them, and that we're looking at developing other interventions rather than the use of antipsychotics. And we have a patient representative on the team overseeing the development of these initiatives. The second one is actually an example from one of our funded projects this time, and it's looking at foot care. How can we prevent foot ulcers? Foot ulcers are prevalent in patients with diabetes, and when they develop, they are exceedingly debilitating and can lead to much more complicated and distressing conditions for the patient, and indeed could, in the worst case scenario, lead to amputation. So what they're finding is that signs of inflammation are often missed. If you can spot the inflammation early, you can do something about it. What they used to do to identify the inflammation was use a very expensive medical thermometer. A lot of people couldn't afford the thermometer. This put them at a disadvantage. The project that is being led by Kathleen, I can't remember if it's Sid or Stevens, my apologies, is to actually look at using a low-cost thermometer that is available from your hardware stores to monitor the temperature of the individual's feet and identify early signs of a problem of inflammation by an increased temperature. We have a caregiver involved in that group who is assisting with the development of the information for patients and also the recruitment of patients. The second example, which is again from our funded projects this time, is in relation to autism support and specifically about applied behavioural analysis. This is being led by Karen Tolk, who is over in the Western Regional Health Authority. And we're looking at how we can offer high quality care for people with autism in rural areas. ABA, Applied Behaviour Analysis, is offered to the families of children with autism as a way of assessing and finding ways to manage behaviour. But to do that, currently you have to travel, perhaps from Portabass to Cornerbrook. That's an awfully long journey for a small child who's then going to have to go through a day of teaching in their mind. So what Karen is looking at is actually whether the service, the program, can be delivered via telehome care using a mobile device. Being piloted with families in rural areas to evaluate their experience and the cost effectiveness of delivering it in this way. And again, we are looking at engaging families as a partner, and I believe approaches have been made to the Autism Society to engage them in this program. I'm sure you're all aware of how active the Autism Society and what good work they do in the province. So that's really coming to the end of my presentation. I hope that's given you a good overview of what Newfoundland Support does, what we're able to offer you, and also how you may be able to contact us. We also have other resources available. We have a jargon buster, which I think Eva wanted me to read before I started this presentation. So I did try and get all the jargon out and abbreviations. I'm sorry if I left any in. We also have a patient and public engagement planning template, and we have tools for patient partnerships in research. So really I'd like to open up the chat room for questions. I know Eva's been typing away behind me throughout the presentation, but if anyone has any specific questions, we've got about 10-15 minutes of questions, and then Eva will briefly wrap up. Okay, so I covered everything.
Well, there are people riding.
Oh, I understand from Eva there's people riding, so I just have to be a little bit more patient.
Okay. Then riding.
Okay, I mentioned this is a question from Susan Gould regarding child and young adults and mental health. What happens to adults? I can understand where that question is coming from, particularly with a number of issues being raised in Newfoundland recently regarding the transition from child mental health services to adult mental health services. The project that is being run through the Mental Health Network does have a specific focus on the child and adolescent and doesn't focus on adults. But what we can do is forward that question to Kathy Payton, who is our lead, and see if it has been considered within the discussions that they have had. Mike Warren, can we follow up with questions after the session? Yes, you most certainly can. We'd be delighted to have questions from you, and the presentation and slides will be on our website. Okay, can you talk a little bit about our hardware and software resources at Newfoundland Support? I can talk a little bit about it, but we can also provide you, Christine, with the man who knows about it, which is our Assistant Director of CHEER, Mr. Mitch Sturge. Okay, we have high performance compute capacity, up in the Centre for Health Informatics and Analytics in our Data Management Centre. That is mainly used for the analysis of genetic information. But we also have an OpenStack environment with a number of cores that are available to researchers, which can be assigned to researchers, where they can, if they have a large data set, they can access the cores within CHIA and which will enable them to analyze their data set much more rapidly than they would be able to do. I'll just give you a quick example. Dr. Guanju Zhe from Genetics has done a large amount of work on osteoarthritis, and the data set he used for his publication took him approximately 3 months to analyze on his laptop. When he submitted his application for publication, he was asked to provide information on another 3 or 4 data sets. That would have taken him another year on his own laptop. It took us less than 1 or 2 days within CHIA. So that's the resources we have in terms of analysis, high performance compute and OpenStack. The hardware and all of our systems run on a Linux environment. Our hardware is all IBM, and because we purchased it as they moved over to Lenovo, or they sold their server arm to Lenovo, it's IBM and Lenovo hardware. But Christine, what we'll do is we will send you Mitch's information, so any specific questions you may contact him for more information. Okay, I don't think I missed any. Oh, I don't think I missed any questions. So, if you do have any questions, please type them up. I'll keep an eye on them as Eva just wraps up.
So, this was our first webinar. This was just an introduction in patient-oriented research. Our next webinars will be more focused on a specific topic. For example, we have a webinar about change management, about health economics, about patient engagement, about health outcome methods, and about big data. So that will all follow in the coming months. I would like to let you know that this training program is free of charge as our support services, and anybody can join. You can sign up by going to our website, go to Eventbrite, and all the webinars will be posted there. They are not all there, but they will follow in the next month. And we will also offer face-to-face workshops. Those workshops are a requirement for people who would like to apply for the grant or will be selected for the grant. And if you complete the workshops, you will get a certificate, and if you complete 5 of the 7 webinars and a workshop, you will receive a certificate in the training program. So save the date for our next sessions. The next one will be October 20th, and then we follow up in November 10th. Just to note that this date has been changed. So the November one is now November 10th, value for money. And the other ones will be announced on our website soon. You can sign up for them all on Eventbrite. They will be available soon. Are there any questions? We have one question. Let me check. We have a few questions. If I'm just have a look at them now. There is here a question from Shannon. I'm thinking about applying for a PhD program in Montreal. Are there any examples I can ask? Shannon, if you're thinking about applying, I guess the best would be just to contact us so we can meet and discuss your ideas. And there might be, I can definitely connect you with examples of our past applications. So please just contact us and we can connect you to the right person. There's another question. When we spoke about communities at the mall and town hall and come up with key concerns of the public regarding their health care, you listed their concerns. You listed healthy living, wait times, and accessibility to services. Was the list in order of priorities? No, the list was not in order of priorities. All those priorities that we mentioned are the priorities we heard, and of course there might be some of them who were mentioned more than others, but we all consider them as priorities. There's another question from Patty. Can you email us a link to the survey after? It's not a live link here on the screen. Thank you, Patty, for letting us know. Of course, we will send you an email with the link to the survey. We would love to hear your comments, and in that way we can improve our webinar. So please share your ideas, share your comments with us. We will share a link with you. That's a smiley face. Thank you for that. Any more questions related to the training program or to the presentation? I don't see any questions now, but please feel free just to contact us by email or by phone, and then we can contact you and discuss your questions also after this webinar session. And you can also sign up for our newsletter, and in that way we can keep you informed about any training opportunities or funding opportunities. So thank you all for joining us today, and we hope to see you next time. There's one last question: where can we download the presentations of the webinar? This webinar will become available on our website, so www.analsupport.ca, and we will make the presentation available hopefully maybe tomorrow and otherwise next week. Okay? We will leave the chat live for a little bit, but anybody who wants to leave, feel free to leave, and hope to see you next time. I don't think so.